So this video is going to be on hookworm. But first, this is Bailey. She has the two cute cats that keep coming in the videos. This is hookworm, so our ancylostomas. The two main ones that we talked about are going to be caninum and tubiforme. Caninum is going to be the dog hookworm. Tubiforme is going to be cat hookworms, but there are also two other type of hookworms. Ancylostoma brasiliense, which is dogs and cats, and then Uncinarius and stenocephala, which is with dogs. So our definitive host is going to be dog and cat, depending on which species that you're talking about. It's a direct life cycle. The adults are going to be worms that have two cutting plates in their mouth, and then they each have 3 teeth each. And the eggs are what are called a morula, which have all the little egg things inside of them. And then there are different ways that dogs and cats can get infected with hookworms. There's oral, cutaneous, lactogenic, and then auto-infection. Cats can only get it through oral and cutaneous, so cats cannot get it lactogenic and auto-infection. So to get it orally, they have to ingest the L3, which goes to the intestine, L4, L5 adult. They mate together, pass eggs in the feces, and then they have further development in the environment. Cutaneously, L3 will penetrate the skin, move to the lungs. There they are coughed up and swallowed, move to the small intestines, become adults, and then follow the same track. Lactogenically, so hookworms can hyperbiose in the dog, so it's the Ancylostoma caninum. Those are the ones that are able to hyperbiose. And so when a mom dog is about to have a baby, they can sense the hormones associated with that, so that wakes them up. They move to the mammary glands, and then they can infect the puppy through the milk. Pathogenesis is done by the L4 and the adults in the small intestine, so they are major bloodsuckers and they constantly move. And so since they're constantly moving, they are constantly making new sites that are going to be bleeding. So the infective stage is going to be L3. The diagnostic stage is going to be the egg. Diagnosis is you can do clinical signs for the paracute infections, which I'll talk about once I get down here. But otherwise, you can do a fecal float. Treatment for your neonatal puppies are going to be 2468 with pyrantel pamoate. And then all the other ones, you do antihelminthics, you repeat the dose in 2 weeks, and then you'll do another fecal float in a month to make sure that it's gone. So your general signs are going to include anemia, a high capillary refill time, melena, which is dark bloody feces, so it's going to be like black and tarry, and then an unthrifty appearance. But then there are different ways that it can present based off of the age of the puppy or the dog. So paracute is going to be in your neonates, so your 7 to 14 day old puppies. They can only get it from lactogenic transmission, so that means that the mom had the auto-infection that reactivated. So they'll have melena and they'll have diarrhea, but they'll have no eggs because there hasn't been enough time for it to have eggs in the feces. So that's the one that you can only diagnose based off of clinical signs, and you treat with 2468 pyrantel pamoate. Then once a puppy is over 8 weeks old, it can be acute, so they would get this through either oral or cutaneous routes. And anemia, melena, they'll be weak. They will die if they don't have any treatment, but these will have eggs. Chronic compensated are going to be your mature, healthy adults. They tend to be asymptomatic, and they'll have a low number of eggs in the feces. Secondary decompensated is when an adult dog is malnourished. So they do have worms, and they have a high egg count, and they're going to have melena and be unthrifty as well. Okay, this is Toxocara, so this is going to be our roundworms. There are 4 different species that we need to know. Toxocara canis is our dog roundworm. Toxocara cati is our cat roundworm. Then there are 2 minor species, Toxocara leonina, which is dogs and cats. And then Basilaris prosinosis is raccoon roundworm. We'll get to those in a second. Okay, definitive host, dog, cat, raccoon. There's a lot of parasitic hosts, but I included humans on here because there are a lot of different things that can cause in humans. The adults I didn't really want to draw, but our eggs, I think they tend to have like what looks like a ropey appearance around the edge of the eggs, and then the inside will be very dark. How do they get it? Their life cycles, it's very similar to hooks. You ingest the L3 that's in the egg, so that's important that the infective stage is the egg with the L3, But our diagnostic stage will not have that L3 yet. It has to finish developing in the environment before it gets the L3. And the typical life cycle is what's called a hepatopulmonary tracheal, where it goes to the liver, goes to the lungs, cough and swallow, goes down to all of that kind of stuff. Pathogenesis. So something to note is that if a dog is older than 3 months, when it reaches the lungs, the immune system tends to kick in and it forms somatic hyperbiotic larvae. So usually in an older dog, you won't really see symptoms unless there is some kind of immunocompromised thing happening. So you'll see it in younger dogs. It can cause loss of nutrients, impactions, intussusception, perforation, liver scarring, and petechiate in the lungs. Diagnosis, I didn't know where else to put this, but there's a thing called age-related expulsion, where when puppies reach 6 months, if they have the adult worms, they will just like shoot them out of their bodies. But most of the time, it's just going to be a fecal flu. Treatment, you'll do 2,4,6,8 with parental pamoate for the puppies. And then for your other dogs, you'll do broad spectrum anti-helminthics. I had a note here with roundworms to be careful of the MDR1 mutation that we learned in genetics. My boyfriend actually breeds collies, and he talks about like how they have to avoid certain medications because of this. So you just have to be careful with using like ivermectin and those kind of things with your collies and your border collies. Control with really all of these is going to be pick up your poop. Signs are going to be that they're malnourished, dermatitis, constipation and diarrhea, and some abdominal discomfort. So I'm going to go back up here for a second. Something to note with Toxocara leonina, on our first exam, we had dogs and cats, but this was like going to the like the lions and the tigers and everything, but it has to be only through oral infection, so they do not get it somatic, prenatal, or lactogenic. That one can only come oral. And then this one is the raccoon roundworm, which is really dangerous for us and for birds. So coming down for zoonosis, your Toxocara cati and your Toxocara canis cause visceral larval migrans, where it just migrates all around the body. And of course, it would cause issues with that. Raccoon roundworm can cause neurolarval migrans, which neuro, of course, that's going to be bad. And then all of our Toxocara species can cause ocular larval migrans as well. This is Trichuris, which is the whipworm. There are 2 species we need to know. Vulpes is for dog. Campanula and serrata is going to be for cat. So then our definitive hosts are going to be dog and cat. It is a direct life cycle, so there's no intermediate or parent-tenant host. Didn't really talk about adults. Our eggs are going to have the bipolar poles that are going to be straight across from each other, which is something that we have to note because there are 2 ruminant parasites that kind of look like this, but their bipolar poles are not going to be straight across from each other. So whipworm is going to be in a straight line. Life cycle is direct. Pathogenesis, the adult's attached to the large intestine mucosa. So whipworm is found in the large intestine. It eats fluid and blood, and it causes hemorrhagic colitis. It can also be associated with hypoadrenocorticism. Infective stage is going to be the egg with the L1. So this egg that has just come out in the feces is not infective. It's just the diagnostic stage. It has to develop sometime in the environment. Diagnosis is going to be a fecal flu, but there is a IDEX antigen test that's available that will test positive before the eggs even show, so you can get an earlier diagnosis. Big thing with these is you do not treat with nicotinic agents. They do not work, so we cannot treat whipworms with parental pamoate. We can treat it, though, with the other 2 classes of benzimidazoles and macrocyclic lactones. It is most prominent down here in the southeast. It is not zoonotic, thankfully. Signs is diarrhea with or without blood, so that is known as hematochezia, which is bright blood in the stool, or frank blood, 2 names for it. Straining in the puppy, dehydration, and chronic weight loss as well. So this is Physoloptera, which is the stomach worm. It is definitive host is going to be carnivores, and this one is an intermediate, or it's an indirect life cycle, so it has intermediate host of your bugs, so your crickets, beetles, and cockroaches. Your parotenic hosts are going to be mice and frogs, and really anything that eats those insects. The adults are going to be located in the stomach. These eggs are unique in that they are eggs, but they have a fully developed L1 within the egg that you can physically see. In the life cycle, the definitive host will lay eggs with the L1 in it. The bug will eat the egg. It goes L2, L3 within the bug. The definitive host will eat the bug. The larva is freed up in the stomach and eventually develops and leads all the way to the eggs with L1. Pathogenesis, it forms ulcers in the stomach. Again, its infective stage is L3 in the intermediate host. The diagnostic stage is going to be the egg with L1. Diagnosis, you can do a fecal float, but it's kind of hard because it requires sheathers and centrifugation because these eggs are really heavy. And it's also not uncommon for single-sex infections. You only need one worm to cause symptoms, so you may not be able to do all of this. Treatment, all of its extra labels, you can do pyrantyl pamelate and fenbendazole. It's not zoonotic, and its signs, there's not going to be any diarrhea. There's going to be gastritis. These tend to be your happy vomiters, weight loss, and anorexia. This is Strongyloides stercoralis, the intestinal threadworm. Its definitive hosts are dogs, cats, primates, and humans, so us. It's a direct life cycle. So interesting with this is there are only females. Only the females are parasitic, and they actually do not require males to reproduce. They reproduce via parthenogenesis. Their life cycle, the larva will penetrate the skin. It can also be ingested. It migrates to the blood, goes to the lungs, goes to the GI tract, so cough, swallow. The adult females will produce eggs that go into the environment. Well, sorry, they develop into L1 first, and then they go into the environment, and then L2, L3. And that's important because in our small animals so far, this is our only one that's going to be L1 as the diagnostic stage because it develops into a larva before it passes in the feces. Pathogenesis depends heavily on the worm burden, causes inflammation and necrosis of the small intestines, and can disseminate in young puppies. Infective stage is L3, diagnostic stage is L1. Diagnosis, because this is a larva, is going to be a Behrman. Treatment is extra label, so fenbendazole and ivermectin. Control is, of course, pick up your feces. It is zoonotic because we're one of the definitive hosts. Signs are going to be anorexia, coughing, pneumonia, pruritus, and dermatitis. This is Diploidium caninum, which is the flea tapeworm. So its intermediate host is a flea, and it requires it, so it's an indirect life cycle. Definitive hosts are canids, felids, and us. The adults are part of the true tapeworm family. They have a unique egg, it's called an egg packet. The life cycle, the definitive host will release the gravid proglottids, which release the eggs. The eggs are ingested by a flea larva. Flea develop into adults with a metacestode inside of them. The dog will eat said flea or cat or baby and develop into adults in the small intestines and then keep going. So the infective stage for all tapeworms in small animals are going to be the metacestode in the intermediate host. The diagnostic stage here is going to be the egg. Diagnosis can be ID the proglottids and do a fecal float or sedimentation. Treatment is going to be praziquantel and esperantil, but it's also important to do flea control with this one. So that class is going to be isoxazolazine, which I'll end with Laner for our flea control. Of course, flea control. It is zoonotic. We can only get it by eating the flea. Signs are usually minimum, can cause GI blockage and some emaciation, and then scooting when it comes out of the rear. So this is going to be tinea. There are two species of tinea. There's tinea pisciformis, which infects the dog, tinea teneaformis, which infects the cat, and those are their definitive hosts, is whatever goes with their name. Intermediate host for pisciformis is going to be rabbit. So pisciformis is dog and rabbit. The intermediate host for teneaformis is going to be rodent. So teneaformis is cat and rodent. They are true tapeworms. They're going to be in the small intestines. Their eggs, kind of hard to draw, but they have like this weird outer border, but they have what my parasitology teacher in undergrad called like a chicken foot in their life cycle. Is just a typical indirect life cycle where they pass the proglottids with the eggs that go to the intermediate host and develop there, and they have to eat the intermediate host. Infective stage is the same as all other tapeworms, metacestode in the intermediate host. Diagnosis stage is the egg. Diagnosis, you can ID proglottids, you can find the eggs in the float, but the best is going to be a PCR. So PCR for tinea. Treatment is praziquantel. You can do fenbendazole, but fenbendazole should only be for pisiformis. So fenbendazole should only be for dogs. Control, you prevent scavenging. It is not zoonotic, and the signs, they're typically asymptomatic unless it's a heavy worm burden, but it'll be obstruction and impaction of the adult worm. So this part is going to be echinococcus. I've already talked about echinococcus with our ruminants because the intermediate host is sheep, but this board is going to be for the definitive hosts, which are going to be our dogs. So there's two species, granulosus and multilocularis. The biggest difference between these is that in granulosus, dogs are only the definitive host. In multilocularis, dogs can be the definitive host or the intermediate host. And the intermediate host is the one that has more symptoms, so that's where it's scary. The adults are small, only about 3 to 5 segments, so you really won't see them or the proglottids. The eggs look the same as tinea, so that's why the diagnosis needs to be a fecal PCR, because you can't tell the difference from them based off of a fecal float and everything. So a dog will ingest the hydatid cyst. It'll go to the intestines to become adults and pass the eggs in the feces. The intermediate host, the sheep, will eat the egg and form a cyst. Okay, I forgot to write it down, but the infective stage for dogs is going to be that hydatid cyst, and their diagnostic stage is going to be the eggs. Again, the best diagnosis is fecal PCR. Treatment for our domestic hosts are going to be praziquantel. If a dog has a cyst, the only way to get rid of it is through surgical removal, so that's if they're the intermediate host. Control, you prevent scavenging. It is zoonotic for us, and we are the intermediate host, so we have to eat the eggs. If you're the definitive host, there's going to be no symptoms. If you're the intermediate host, there's pressure necrosis, atrophy, hemorrhagic masses, loss of organ function, and this can also mimic cancer masses as well. This is mesocystoides. The definitive hosts are dogs, cats, and humans, so it is zoonotic. It has 2 different intermediate hosts. The first is going to be an insect. The second is going to be reptiles, small animals, and sometimes dogs. So dogs can be both the definitive host and the intermediate host. The adults are true tapeworms. The eggs, they have this hexacanth embryo, but they're very thin and very clear, so they look different from our other tapeworms. Life cycle is indirect, so it's going to go definitive host, lays eggs in the feces, go to the first insect, gets eaten by the second one, then goes back to the definitive host. Infective stage, so it's typically the metacystid in the second intermediate host, but of course, if the dog eats this first one, then it's going to be the second intermediate host. Diagnostic stage is going to be an egg. Diagnosis, looking for the eggs in the fecal or abdominal aspirate. Treatment, if it is the definitive host, is going to be praziquantel. If it's an intermediate host, fenbendazole and surgical removal of the worms. Control, you prevent predation. Signs, if they're the definitive host, there will be none. The second intermediate host will have peritoneal larval cystidiasis, so being in the abdomen, anorexia, vomiting, diarrhea, and ascites, and we are a definitive host as well. So these 2 are going to be our false tapeworms. There is Spirometra and there is Dibothriocephalus. So Spirometra is known as a zipper tapeworm. Dibothriocephalus is associated with fish. So both of these we can be the definitive host, dogs, cats, humans. They have 2 intermediate hosts. The first is always going to be a copepod. Second is different for the 2 species. Spirometra is not fish, anything but fish. Can be dogs, cats, and us. Second intermediate host for Dibothriocephalus is always going to be fish, so that's the difference between them. They're false tapeworms, eggs, have an operculum. Life cycle is indirect. Pathogenesis, so Spirometra is special and can cause sparginosis. Dibothriocephalus is special in that it can cause vitamin B12 deficiency, which leads to pernicious anemia. Infective stage is the same. Second intermediate host with the metacystid. Diagnostic stage is egg. These eggs are heavy, so sedimentation. Treatment for these, you have to do 5 times the dose of praziquantel. Control, prevent predation, and do not feed them raw meat. It is zoonotic. Like I said, Spirometra can cause sparginosis, or we can be a second intermediate host. Dibothriocephalus, we are the definitive host, and we get it by eating raw fish. Signs include diarrhea, weight loss, and vomiting. This is Nanophyeta salmonella, which is the salmon poisoning fluke. Definitive hosts are any fish-eating mammals, so that can include us. This is a fluke, so all of their first intermediate host will be a snail. Second intermediate host is going to be the salmonid fish. The important thing is that the eggs have no miracidium in them. They have to develop out in the environment. So I drew the general life cycle for all flukes, and I'll just mark whichever one this goes with. So they have the definitive host will have the adult, goes into eggs and the feces, develop into a miracidium, go to the snail, then goes to the cercaria, and then it'll go over here to the adult. So I actually drew this wrong for this one. Sorry, the arrow was supposed to cut off at the snail because the infective stage for this is the metacercaria in the snail. Pathogenesis. So the worm itself does not really cause any pathogenesis. It's symbiosis with a bacteria called Neorickettsia helminthoica. That bacteria can cause a heavy immune reaction, and it can lead to edema of the lymph nodes and necrosis, and it can also cause hemorrhagic enteritis. So again, the infective stage is that metacercaria. Diagnosis stage is the egg. How to diagnosis is history. Have they traveled to a recent area where this is endemic? Eggs and sediment, and you can do a lymph aspirate for that bacteria. Treatment is going to be mainly supportive. You can do praziquantel to kill the worm and doxycycline to kill the bacteria. The good thing is once they get infected, they can't get a second infection. They become immune. To control it, cook the fish. Don't feed them raw fish. It is located in the northwest coast. It is zoonotic. We get it by eating fish, but we are not susceptible to the bacteria. Signs include sudden systemic infection, high fever, purulent ocular discharge, vomiting, tons of diarrhea, enlarged lymph nodes, and anorexia. This one is Platinosum fastosum, which is the lizard poisoning fluke. The definitive host is a cat. This one has 3 intermediate hosts. First one is always going to be a snail in our flukes, then isopods or roly-polies, and then the third intermediate hosts are going to be lizards or other reptiles. This one's life cycle is definitive host with adult, egg, miracidium, snail, cercaria. Second intermediate hosts are our isopods, metacercaria. Third intermediate hosts are our lizards, and then the adult will eat the intermediate host. Pathogenesis, the flukes go to the bile ducts and the gallbladder. Causes thickening and cirrhosis here. Liver failure and cholangiocarcinomas can develop. The infective stage will be the metacercaria, and the third intermediate host of the lizards. Diagnostic stage is the egg. You can diagnose it by sedimentation for the egg. Treatment, it is extra label, so you have to do high doses of praziquantel and fenbendazole. You have to prevent predation with your cats. Location, I wrote it in the wrong spot, but it's in the tropics in the south here. It's not zoonotic. Signs include anorexia, diarrhea, vomiting, jaundice, which is special, and hepatomegaly. Okay, this is the last worm for this video. Heterobilharzia americana, which is canine schistosomiasis. Definitive host can be canids, horses, raccoons, snail. Biggest thing with the egg, does have a miracidium. It is, yes. Adult life cycle, indirect. The definitive host will have the adult, and they will travel in the mesenteric veins, so that's why there's like liver issues that tend to happen with this. Pass eggs and feces, miracidium to the snail. Cercaria leaves and will penetrate the skin of the definitive host. Causes granulomas in the intestines. Diagnosis, sedimentation with saline. If you do it with water, they will just hatch, so you don't want that. Treatment, you have to control the calcium imbalance first, because one of the signs is hypercalcemia. All other treatments are extra label, so fenbendazole and praziquantel at high doses. Prevention, prevent predation, and avoid unknown waters that might have the cercaria just swim around in it. It is located around here at the Gulf Coast and a little bit in the Midwest. It is zoonotic, but it causes what's called swimmer's itch, where the cercaria enters the skin and it can't go anywhere else. And signs include hypercalcemia, mucoid/hemorrhagic diarrhea, thick intestines, polyuria, polydipsia, lethargy, anorexia, and vomiting.